Our I-Team's work sounding the alarm on pelvic exams happening without consent by the patient has the ear of local lawmakers.
Thanks to your reporting, I think a number of my colleagues were surprised to learn that patients don't have to consent to these invasive procedures.
It's a sentiment being felt on both sides of the state line. KSHB 41 investigator Sarah Plake has the changes that may be coming to state laws.
This legislative session, lawmakers in Missouri and Kansas are trying again to change a medical practice they and advocates say is harmful to patients.
Tell me why this is so important for you to file this bill.
Because I can think of no more egregious invasion of privacy than waking up and realizing that there had been a pelvic exam done on you without your expressed informed consent.
Sarah, this is a gray area.
The KSHB 41 I-Team first told you about this in October.
I know that I didn't consent, and I know that we didn't talk about it because I woke up in the middle of the exam screaming.
That it's legal in Kansas and Missouri for doctors and doctors in training to perform a pelvic exam on an anesthetized patient without the patient knowing about it. This happened to Ashley Weitz, who went to the hospital for nausea, vomiting, and a rapid heartbeat. Nothing she thought would require her doctor to do such an intimate exam.
I just wanted to be asked.
These pelvic exams without consent are usually done as a teaching tool.
Thanks to your reporting, I think a number of my colleagues were surprised to learn that patients don't have to consent to these invasive procedures. And thankfully, we've been able to continue to find bipartisan support to require consent.
Missouri Senator Lauren Arthur and Kansas House Representative Rui Xu filed bills in 2021 and 2020 to require that doctors and students get the patient's consent first, but they didn't pass. They're optimistic, however, they'll pass this year.
I'll pre-file the bill and then start my conversations with various stakeholders and see if they're willing to finally have a hearing on it.
Arthur has already pre-filed her bill, Senate Bill 106. Her Republican colleague, Representative Hannah Kelly, also filed a similar bill in the House. Arthur said they're likely going to go with the House version because last year, that's the version that made it the farthest.
A number of advocacy groups have gotten involved and made this their priority. So I suspect lawmakers will hear from those, from their constituents and from those advocacy groups going into session.
Xu said it was difficult to get the medical lobbyists on board with his bill.
Do you anticipate seeing the same pushback like you did before?
I don't think so. I think the public conversation, also based on your piece, has changed it a little bit.
If the Kansas Medical Society has an issue with the legislature writing healthcare law, Xu says he'd support them handling the issue themselves.
You know, if the legislative push helps it happen internally with the Medical Society or Board of Healing Arts, great, but it has to be done legislatively. I think it's important enough that we do.
Arthur says passing this bill will not only protect patients, but also doctors in training.
It would mean that my constituents, our patients, have a better say over what happens to them, that they receive appropriate care, and that our future doctors are well trained and also don't have to feel bad about some of the things that they're asked to do.
Sarah Plake, KSHB 41 News.